The Nuffield Trust's 8th Annual Health Policy Summit in 2016 was an opportunity for health leaders to explore some of the pressing issues facing the NHS in today's stressed landscape with its tight budgets and ageing population. Presenters focused on how these challenges might be addressed, drawing on examples of good practice in the UK and abroad.
If change is a human contact sport, you best contact human beings. Now, by that I mean that change is not about policy. Change is not about politics. Change is about human beings that work and care for patients.
How best to develop the skills of the health and social care workforce was a recurring theme. Training is key, but shrinking resources don't help.
Just at the point when we need to redevelop our workforce, whose budget has been cut most? Health Education England. And which budget is most vulnerable? The bit that the tiny proportion, 250 million of the 4.5 billion, is spent on this type of activity.
Candice and I have kind of been trying to say the same thing for some time now, which of course is that you can't redesign the workforce until you've redesigned the work. Engaging clinicians actually in the design of the work. And when we've figured out what the design of the work is, then we can begin asking ourselves, well, do we now have the appropriately structured workforce?
But it's not advisable to race headlong into change without considering the implications. Delegates heard from Dr. Robert Wachter via video link, who pointed out that innovation can have a downside.
This gentleman, whose name was Wally Miller, was the head of chest radiology at the University of Pennsylvania, where I was a student. And every single day, all of the teams, the medicine and surgery teams, came down to the chest room to go over their films with Wally Miller. When I say to my students and residents now, let's go down to radiology, they look at me like I'm crazy, like I don't know that I don't have to go down there to look at the films because they're on every computer all over the building. Now, you might say, well, no big deal. You can look at the films anywhere and you can read their report. But I think the loss of the collegial contact with the radiologist has had a profound and negative impact. Again, something we gave no thought to.
Technology got a mention from Health Secretary Jeremy Hunt when he told delegates his priorities for the health service. He played down reports that the NHS was at breaking point.
If you look at the media every day, there is a sense of a service in crisis and lots and lots of things going wrong at lots of different levels. But if you look at the facts, there has actually been an incredibly impressive response to really tough conditions.
Shadow Health Secretary Heidi Alexander outlined the principles behind Labour's health and social care policy.
If I was stopped on the street and someone asked me to sum up Labour's priorities for health and social care, I would put it like this: fund it adequately, staff it properly, and support improvement and innovation.
Full videos of most of the sessions, presentations and news and commentary can be found on the Summit website.